This video will be a demonstration of diagnostic ultrasonography for the medial collateral ligament. The anatomy involved really is two ligaments, the superficial medial collateral ligament, or the SMCL, and the deep medial collateral ligament, the DMCL. The SMCL attaches to the medial femoral condyle proximally and to the semimembranosus tendon in the posterior medial tibia distally. The deep MCL is further divided into two portions, the meniscofemoral portion and the meniscotibial band. Meniscofemoral portion connects the femur to the medial meniscus, and the meniscotibial connects the medial meniscus to articular cartilage of the medial tibial plateau. Here is a little image of the MCL, its various layers, and the bands and where they connect. Patient positioning is important when looking for the MCL. The patient can be either seated or supine, and references will say that the knee should be flexed anywhere from 20 to 90 degrees. Personally, it will vary depending on the person's MCL. When evaluating the MCL, palpate the medial epicondyle, place the transducer, then slowly migrate distally towards the tibia. What you will find, as seen in this cross-section, is you will see a reflective femoral surface followed by hyperechoic dense tissue right above it, which is the superficial MCL. The transverse view provides a much better look at the tibiofemoral joint, including the MCL. As we'll see in this cross-section here, the femur can be seen on the left, the tibia on the right, the joint space in between, and the hyperechoic MCL, deep layer most closest to the femur and the tibia, followed by a brighter, even more hypoechoic structure right above it that is the superficial MCL. On this cross-section of the longitudinal view, we can easily see the reflective medial condyle inferiorly, followed by the superficial MCL section that is hyperechoic just superior. In this cross-section of the transverse view, we can easily see the femur and the tibia, located in red and yellow respectively, followed by the medial meniscus and the joint space as the green, with the deep MCL blue layer being hyperechoic just superior to the femur and inserting on the tibia, with the superficial MCL in orange being the hyperechoic band just superior to the deep MCL. Clinical take-home points: you can visualize the MCL injury using ultrasound, but it is important to utilize multiple views in order to assess damage to both portions of the MCL complex. As we've seen, the deep MCL is hard to visualize in the longitudinal view, so a transverse view is always needed. Part of the ligament should blend with the medial meniscus and another with the semimembranosus tendon, so this will allow clinicians to analyze multiple structures of the medial knee in one assessment.